Hi everybody, my name is Michelle Antonellis and I am your manager for infection prevention and control. Today we will be teaching you how to safely don and doff your personal protective equipment. I want to thank all of you for watching this video and for your commitment to patient safety and infection prevention practices. Stay safe and stay healthy. Thank you.
Getting ready to don your personal protective equipment. The PPE required for strict isolation includes gown, gloves, protective eyewear, and respiratory protection including an N95 mask which has been fit tested in the past year. When wearing a gown as part of isolation precautions, it's best to remove lab coats or other extra items of clothing such as sweaters, fleece jackets, or vests. There are two reasons for this. First, wearing a gown, gloves, protective eyewear, and respirator can get warm. Having additional clothing underneath can make that worse. Second, long sleeves, knit cuffs, and other bulky clothing can make it difficult when doffing your gown, and it may increase the risk of contamination. Another best practice is to ensure that your hair is secured and out of the way to avoid touching hair while donning your PPE. The final step before donning PPE is to remove your personal stethoscope before going into the room. There will be a designated stethoscope for that patient in that room. Now we will demonstrate donning PPE for strict isolation. The first step when donning PPE is to perform hand hygiene. Make sure you cover all surfaces of your hands, and if using an alcohol-based hand rub, make sure that it fully dries. The second step is to don your gown. Unfold the gown and put arms through sleeves. Slide thumbs into thumb hooks. Pull the gown over your head and straighten out the gown. Tie the waist ties. The next item to be donned is your mask or N95 respirator. We will demonstrate donning the N95 respirator. Cup the respirator in your hand with the nose piece at fingertips, allowing the head straps to hang freely below hand. Position the respirator under your chin with the nose piece up. While holding the respirator in place, pull the top strap over your head so it rests high on the back of your head. While continuing to hold the respirator firmly in place, pull the bottom strap over your head and position it around your neck below your ears. Untwist the straps. Position the respirator low on your nose. Using both hands, mold the nose piece to the shape of your nose by pushing inward while moving your fingertips down both sides of the nose piece. Always use two hands when molding your nose piece. Pinching with one hand may result in improper fit and less effective respirator performance. The respirator must be checked before each use. To perform the fit check, place both hands completely over the respirator, being careful not to disturb the position, and exhale sharply. If air leaks around the nose, adjust the nose piece as described in step 5. If air leaks at respirator edges, Adjust the straps back along the side of your head. Perform fit check again if an adjustment is made. If you cannot achieve a proper fit, see your supervisor. Do not enter area requiring respirator use. Once your respirator is in place, the next piece of PPE to put on is your face shield or goggles. We will demonstrate putting on goggles in this step. Place goggles over your face and eyes and adjust. Goggles are put on the same way that you would put on glasses. Please remember that glasses are not protective eyewear. Please wear a face shield or goggles over your glasses. The final stage of PPE is to put your gloves on. Gloves should be donned and pulled up over the cuffs of the gown. You are now ready to enter the strict isolation room. Now we will doff or remove your PPE. Remember, in the doffing process, all movements should be slow and purposeful to prevent aerosolizing of contaminants. If there is an anteroom, all PPE can be removed inside the anteroom. If there is no anteroom, gown and gloves will be removed right before leaving the room. Perform hand hygiene, exit the room, perform hand hygiene again because you have touched the door handle, then proceed to remove your protective eyewear and respirator per doffing protocol. If there are visible bodily fluids on your gown, you can take a disinfectant wipe and wipe the front of your gown. This will decrease the risk of aerosolizing infectious particles and decrease the risk of contamination. Gown and gloves are the first item of PPE to be removed. There are two ways to doff your PPE. Today we will demonstrate example 2 from the Center for Disease Control and Prevention, which can be found on the wire page. Gown front and sleeves and the outside of the gloves are contaminated. If your hands get contaminated during gown or glove removal, immediately wash your hands or use alcohol-based hand sanitizer. Grasp the front of the gown and pull away from your body so that the ties break, touching outside of the gown only with gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. Perform hand hygiene. Next, carefully remove the face shield or goggles, being careful not to touch your face. Outside of goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based sanitizer. Please follow the reuse and extended use protocol located on the wire. Perform hand hygiene. The last item to be removed is your N95 respirator. Without touching the respirator, slowly lift the bottom strap from around your neck up and over your head. Lift the top strap. Do not touch the respirator. Follow the reuse and extended protocol located on the wire. The final step is to perform hand hygiene after all PPE is removed and before you touch your face or clothing or any surface outside of the patient's room.